I'm going to be talking about the effect of mind medications, specifically antidepressants. SSRI stands for Selective Serotonin Reuptake Inhibitors. They work by blocking receptors that take serotonin, causing an excess that is known to treat depression by making the person on SSRIs feel happier. Some examples that you might have heard of include Zoloft, Prozac, and Lexapro. But how are these different? In order to find out, I went to drugs.com because really, who else knows better than drugs.com? The difference between these starts at what they're used to treat. Like Zoloft and Prozac, for example. They do treat some of the same illnesses, but they have their own purpose. Prozac is used for bipolar-related depression and bulimia nervosa, while Zoloft is used for more anxiety-related illnesses like PTSD and social anxiety disorder. They both act against OCD and major depressive disorder because they are SSRIs, of course. Are they different in how they act in the brain? Well, no, not really. Prozac stays in the brain up to 3 to 4 days longer than Zoloft, sure, but they do the same thing. More differences between the two are usually based on the patient, like medical history and symptoms. They both block the reabsorption of serotonin, but they do have their differences when it comes to side effects. If this was an ad, this would be the part where I talk really fast to try to distract you, but this is important, and I can't talk very fast without stuttering. Prozac, Zoloft, and even other SSRIs have similar side effects, such as headache, nausea, vomiting, nervousness, anxiety, dizziness, and changes in appetite and weight. Wow, these things better be worth it. Prozac is more likely to cause insomnia, whereas Zoloft is more likely to cause issues in your intestines. From what I can see, it's important to look this stuff up if you're taking one of these. SSRIs aren't the only type of antidepressant. Welcome to the world of SNRIs, which stands for Serotonin Norepinephrine Reuptake Inhibitors. Back to drugs.com, of course. SNRIs act the same way as SSRIs by blocking the reuptake of serotonin, but this time, the reuptake of norepinephrine is getting blocked too. According to the author of this article, Carmen Pope, this neurotransmitter is thought to help mobilize the brain for action, increasing alertness, focus, and the retrieval of memory. These antidepressants are unique because not only do they help with depression and anxiety, they can be used for muscle and joint pain, lower back pain, and even diabetic neuropathy. SNRIs differ in how much serotonin and norepinephrine reuptake is inhibited. Some inhibit more serotonin reuptake and vice versa, but that's about as different as they get from each other. And here's the fun part, side effects. SNRI side effects appear to be worse than SSRI side effects, some proving to be fatal. Side effects include suicidal thoughts, lower blood pressure, increased risk of bleeding, and lower total body sodium, aka hyponatremia. Everything has their downside, but it's important to keep these in mind if you're thinking about taking these. There are about 5 types of antidepressants. SSRIs, SNRIs, atypical antidepressants, tricyclic antidepressants, and monoamine oxidase inhibitors. These are all antidepressants that do the same job in different ways. Atypical antidepressants work differently from each other, unlike SSRIs, which all basically do the same thing. According to the National Library of Medicine, atypicals can inhibit reuptake of dopamine, promote dopamine release from receptors, and even promote the release of norepinephrine into the synapse. And about the others, TCAs inhibit the reuptake of norepinephrine and serotonin at the presynaptic neuronal membrane, which is just a fancy way of saying they do what all the other antidepressants do. MAOIs inhibit the monoamine oxidase enzyme responsible for catabolizing serotonin, norepinephrine, and dopamine, making this antidepressant unique. The National Library of Medicine says MAOIs were the first antidepressants discovered, but aren't used as commonly due to their adverse effects and interactions with other drugs. And the big one of them all, can't forget serotonin syndrome. Taking any antidepressant comes at the cost of getting serotonin syndrome, which can be fatal. This happens when too much serotonin is in your body. It doesn't sound real, but you can literally die from happiness. Back to the National Library of Medicine. Serotonin syndrome can cause altered mental status like delirium, can cause seizures, and even autonomic dysfunction. That isn't good considering that damages how your body regulates your heartbeat and other involuntary bodily functions. It's important to be careful with these types of substances. They surely are helpful, but they can have their potential consequences. It isn't perfect, but mental health is incredibly important, and I'm glad it's getting more attention. Thank you for joining me today as we learn about a form of mental health treatment.